Lastly, we have to look at your immune system. Okay, I already talked about the importance of looking at your immune system through the gut, but we actually have to run immune panels to find out, are you autoimmune? Do you have an immune reaction against your thyroid? Do you have an immune reaction against other areas in your body as well? In addition to that, we have to evaluate to find out what imbalance of your immune system do you have. You can have a Th1 imbalance or a Th2 imbalance. These are two different sides to your immune system. The Th1 side is the natural killer cells. These are the cells in your body, your immune system cells, that actually go out and attack and kill invaders that come into your body. The Th2 side are your B cells, and these are basically like Post-it notes that get stuck on these different invaders and basically say, attack me. And so these two systems should be in balance, but what happens with autoimmunity is that one of these systems becomes dominant. And so anything that we do that would increase that dominance, so if you have a Th1 dominance and we do anything with nutrition, with diet, that increases that dominance, you're going to feel worse. If we do things that bring this back to balance, you may feel better. And so supporting and knowing which way your immune system is balanced is very important for a Hashimoto's patient or an autoimmune patient in general. And so we have to identify that. The other piece of the puzzle is we want to identify whether you have what's called an active antigen pattern or you have an immune dysregulation problem. An active antigen pattern is basically a pattern of dysfunction that promotes the autoimmunity, where you have some sort of antigen in your system that your body is reacting to. And this most likely can be some sort of parasite, fungus, yeast, food intolerance, these types of things. So we have to look and find out what kind of pattern of autoimmunity do you have, so we can better understand how to specifically support your immune system to kind of unwind this attack. You know, it's certainly true, you know, with autoimmune diseases are not curable. They're not curable, but they can be managed. They can be supported, and you can feel better if we properly do that. And so this can make a huge impact on how you feel day in and day out when we properly support you, along with working with your conventional medical treatment. Secondary to running the lab testing, like I mentioned, we also have to look at the health of the brain. This is where coming in as a chiropractic neurologist helps, because what I do is we evaluate and we perform a neurologic evaluation where we look at the health of the brain. And what we're looking for is we're looking at areas of the brain that have been impacted because of poor thyroid function or because of poor physiological function that have become damaged and are not working as well as they need to. This can create symptoms like we talked about of depression, anxiety, fatigue, you know, many of these classic kind of thyroid type symptoms. And so making sure that we're supporting the health of the brain, both with nutritionally but also with stimulation, can really impact the health and the symptoms of a patient that's suffering from thyroid disorders. Now, I hope that this has been informative for you. I'm not going to go into every detail of how we work to support the brain, how we work to support every thyroid pattern. You know, it's very exhaustive. We could talk all day about it. But I just wanted to give you a little bit of background information to understand what our approach entails and hopefully help you see that our approach is different. You know, what I can tell you is if you're still suffering from thyroid symptoms and you've been on medication, if you're suffering from thyroid symptoms and all your lab tests are coming back normal, you can't keep doing the same thing and expect different results. If you keep just taking your medication and just expect that someday it's going to get better, it won't. It's probably going to continue to get worse and worse and worse. I'm offering you an opportunity to come into our office and find out and get different answers. Okay, I will continue to dig as deep as I need to dig to find out what is driving the dysfunction that's within your body and help you to support these pathways so that you can start feeling like you again. In closing, I just want you to ask yourself a couple of questions. You know, ask yourself, how is my thyroid function, or how is my fatigue, how is my weight, how has it impacted me? What has it prevented me from being able to do that I would want to do again? How has it impacted my family, my loved ones, my friends? How has it affected my relationships? If this thyroid problem is impacting your life on a daily basis, you need change. We can help you reinvent your life by taking an approach that nobody else is going to do and dig deeper than anyone else has dug. And that's my promise to you, is that we will continue to dig until we find the answers of how we can best support you. Thank you so much for taking the time to watch this video. Explore our website. There's registration forms on there. We would love to see you in our office, and I encourage you to do so. Listen to the testimonial videos that are on the website. You know, patients can say it way better than I can as far as you know, telling their stories and helping you understand the changes that they've seen. So thank you so much again, and God bless.